transgender treatment for kids bill is headed to the governor's desk for his possible signature. The bill would take away a parent's right to decide if their transgender teenager can get hormone therapy or puberty blockers, or even gender-affirming surgery, which, according to every doctor we've spoken to about this, doesn't happen in Idaho anyway. It would make any doctor that prescribes such a treatment a felon and subject them to 10 years in prison and a $5,000 fine. During the Senate floor debate of House Bill 71 yesterday, what they're calling the Vulnerable Child Protection Act, maybe it missed what was said by freshman senator from Caldwell.
I'm not going to read this entire thing that comes from the American College of Pediatricians. It's pretty long. I'm just going to read out a couple of things, but it says transgender interventions harm children. No evidence that transgender interventions are safe for children. So if we're going to listen to doctors, here they are. Take emotion out of it. Here's your science.
Did you catch the name of his source there? The American College of Pediatricians. Sounds pretty legit, doesn't it? Sounds a lot like the American Academy of Pediatrics, which is the leading and largest organization when it comes to children's health and well-being. But the American College of Pediatricians is not the American Academy of Pediatrics. The American College of Pediatricians is a small, like 500 members versus 67,000 members, a small politically motivated group, one the Southern Poverty Law Center calls a fringe anti-LGBTQ hate group, masquerading as the premier association of pediatricians in America.
We were founded in 2002 by a group of physicians concerned that national pediatric policy was increasingly being dictated by social agendas rather than by science, medical ethics, and the needs of children.
Think America's frontline doctors during the middle of the pandemic. The college was created because the American Academy of Pediatrics endorsed same-sex couple adoptions, and some of the college's socially conservative members didn't, and they still don't. The problem, though, the science which they refer to make a case can be considered junk science, according to the Southern Poverty Law Center. And they've made several false claims, the college has, of transgender ideology being child abuse and homosexuality in youth being temporary. They push restorative or conversion therapy. The executive director, who you just heard from, pushes the conspiracy theory that the, quote, transgender movement is, quote, an opening for totalitarian government, end quote. Meanwhile, the American Academy of Pediatrics, the actual leading children's health association, pointed out the college's facts about youth. That campaign doesn't acknowledge the scientific and medical evidence when it comes to sexual orientation, sexual identity, sexual health, or effective health education. Several doctors, by the way, have also demanded retractions from the group because their research was misrepresented in the college's articles and blogs. Taking the emotion out of it is one thing, Senator Trakel, but claiming and citing science that cherry picks facts to prove a point or verify a false claim isn't exactly grounded in good faith. So we'll see what happens with Governor Little, because it's up to him now to either sign it or veto it.